There is a famous saying by Sadhguru, and it says, if the feminine is lost on the planet, nothing of beauty, nothing of tenderness, and nothing truly aesthetic will survive. And that's for all women who are considered to be the most beautiful creation of the Almighty. Welcome, ladies and gentlemen, to Dr. Tapaswini's Corner, and that's me, and I work as a head and neck oncosurgeon at Fortis Hospital. Come October, also remembered as the Pink Month, marks the beginning of breast cancer awareness drives. It is true that every woman needs to know the facts, and the fact is, when it comes to breast cancer, every woman is at risk. Today's discussion is focused on breast cancer, and who else but a woman would be a better expert? So we have here today Dr. Ramesh Sarin. You are a breast oncosurgeon working as a senior consultant in surgical oncology at the Indraprastha Apollo Hospital, New Delhi. Trained at the All India Institute of Medical Sciences, Delhi, in the United Kingdom, and also at the Memorial Sloan Kettering Cancer Center, New York, you are known for your great professional skills. Your practice has centered around delivering a holistic approach to breast cancer patients. You also run an NGO called the Forum for Breast Cancer Protection and have been involved in the production of many groundbreaking films aimed at generating awareness and providing guidance to breast cancer survivors. Welcome, Dr. Sarin, and it's indeed a pleasure to have you on the show today.
Thank you, Tapaswini. It's very kind of you to have me on the show. I am honored and pleased to answer all your queries for the sake of the most important person, the women.
Yes. So, looking at the statistics, we realize that every 4 minutes, one woman in India is diagnosed with breast cancer. Worse still, one in every two affected women dies of it. So, what is the cause behind the rising incidence? And secondly, is rapid urbanization impacting its numbers?
That's actually very true that there is a substantial difference between the rural and the urban society.
Right.
Urbanization has increased breast cancer threefold. So obviously, there is something that happens when a person migrates from rural to the urban areas, and this is industrialization and our lifestyle changes to
Okay.
the Western one.
As women with time, they have progressed to shoulder responsibilities equal to women. So, has that pushed them to a lifestyle which has made them more susceptible? We would love to know that from you.
These are lifestyle changes, and these are obesity
Okay.
because we are eating more of junk food. When
Uh,
you're working as a professional and you have no time for a home cooked food, so you pick up a quick bite from a junk restaurant. Secondly, we do have sedentary lifestyle as against the rural women. We also have sleep disturbances because there are lots of stresses contributing to higher risk, though we haven't had the scientific data to it.
okay.
Now, also having lesser children.
Right.
The data has shown that the urban women
Mm-hmm.
average children are 2.1, and in rural the average number of children are 3. Our nutrition is better, we eat better, and so our period starts early. Earlier
Okay.
on the women started their periods at the age of 15 and 16 because they were malnourished. Now with good
Mhm.
nourishment you have almost a full blown women by the time of 20, 12 and 13. And also
Right.
we have menopause late. So the more the number of ovarian cycles and more the number of estrogen
Right.
that is liberated on our body has something to
Okay.
do with breast cancer.
Okay.
Now, if you understand that urbanization, apart from looking after our diet and being a little bit more exercise and keeping your weight in check, and having a better sleep and having stress-free life, or at least looking at our stress, the rest of the factors are not in our hand. To
Okay.
have more children, to not have early menarche, to have not late menopause. So all these factors we have no control on. So what do we have? The next best thing. The next best thing is to be aware of early signs of breast cancer. Some lifestyles can be changed and
Right.
some cannot be changed.
Correct.
And if it cannot be changed and you're the one to get it, at least you should be able to go to the doctor in very early stages.
Correct. Yeah.
Coming to the same thing, the incidence in the rural area is only about 12 or 13 women per 100,000, while in the urban area it's almost 39, so it's three times
Okay.
more in the urban area, but the mortality in the rural area is the same as in the urban area. And that is because in the rural areas women are not aware of early signs, and
Okay.
even if they go to the doctor, the facilities are not there, the expertise is not there, so more number of women die. In the urban area, though the incidence is increasing, but the death
Okay.
rate is decreasing
All right.
because of earlier diagnosis and because of better treatment.
Okay. So when we talk about lifestyle, most of the cancers have an association with smoking and alcohol. So does breast cancer in some ways have any correlation with these? Because a lot of women have
Then
started taking to alcohol and smoking.
yes, very true. I think we have to start talking about alcohol because it's
Yeah.
becoming a fashion,
Yes.
even in India. Though smoking is not as much as in the West,
Okay.
but alcohol is definitely associated with a higher incidence of breast cancer, especially
Mhm.
if you're taking more than two or three um, pegs of whiskey or wine. It
Mhm.
does increase your risk to double.
All right, right. So at times also we get the fear that using oral contraceptive pills to defer child bearing, that also has an impact. Is it true?
The oral contraceptive pills have not been statistically
Okay.
proven to be of any harm,
All right. Okay.
especially if you're only going to take it for 5 to 10 years. And in
Mhm.
any case, I think most women will not use it continuously for more than 10 years.
Oh,
But short term, it's not proven to be a risk factor.
okay.
But yes, in the same vein, something called HRT, hormone replacement therapy, that lot of women in the past had taken to postpone their menopause.
Okay.
Menopause causes obesity, causes wrinkles on the face, like me, makes you look older. So lots of women took the hormone to look younger, to
Uh-huh.
have better bones and to look better. HRT is definitely associated with higher incidence. But
Right.
now I think lots of women don't try to postpone their periods.
Okay. So what I understand is that breast cancer is primarily looks to be influenced a lot by the female hormones. Do males also suffer from breast cancers?
Good question. The males also have breast cancer,
Mm-hmm.
but the incidence in the male is 1 to 100. If
Okay.
100 women get breast cancer, one
Correct.
male will get a breast cancer. And the importance is that if you have it in the male, there
Right.
is a higher chance that it may be genetically
Okay.
transferred over to you from your parents.
Right. Right. So, as you said, I mean, there's a lot of fear that it can run in families. So, if mothers have breast cancers, they are quite worried about their daughters. What is the genetic correlation in causation of breast cancers? What is
Yeah,
that gene which is implicated, and how important is it? And what is the
right.
incidence that we have? Yeah.
Right. The Paswani, lately the genetic predisposition or genetically inherited cancers have taken a front line and are being discussed a lot. But we
Okay.
must understand that all cancers are due to gene disturbances.
Okay.
Somewhere the gene is either mutated or underproduced or overproduced, but we do not know many of the genes which
Okay.
cause cancer.
Mm-hmm.
We know two genes,
Right.
BRCA1 and BRCA2 genes,
Okay.
which we know we can actually estimate them, and it's estimated in a blood sample
Okay.
because every cell that is formed in the body can have this gene abnormality, but it occurs in about 5 to 10% of the patients with breast cancer. So
Okay.
if I have 100 breast cancers, 5 to 10 people can have BRCA1 and BRCA2 gene abnormality, which means
Okay.
that they have inherited from their parents,
All
which could
right.
be a mother or a father.
Okay.
And also 50% of it can be passed on to their children, which
Okay.
could be a boy or a girl. There are certain segments of patients which we advise to get the BRCA1, BRCA2 done. That means they are more prone to have it positive.
Hmm.
And if we do it in them, and if they are positive, then we advise the children to have it.
So what I understand that BRCA gene is present in all of us, but it is only when it is mutated, then it causes some sort of a nuisance in the human system. So,
Correct, correct.
so when you have these mutations, other than the breast cancer, does the patient suffer from other cancers also, or is it only pertinent with the breast cancers?
Now more and more of knowledge is coming up, and
Right.
if you have a BRCA mutation, it can be present if you have a pancreatic cancer,
Okay.
and if you have a prostate cancer which has metastasized,
Correct.
and if you have a male breast cancer. These are the three areas where if you have these cancers, you need to get your BRCA testing done.
So all these individuals, I mean, they have to undergo a surveillance. They need to be forewarned. So if we
Correct.
find these, the cancers running in family, genetic mutation, if it is found, so the siblings need to be counseled. They also need to be put under a scanner. So, we always say that the best protection is early detection, and the key liner is early detection saves lives. So, what are the earliest signs and symptoms that one should worry about when it comes to breast cancers?
Before I tell you what are the early signs and
Right.
symptoms, I just want to make a point over here.
Okay.
The medical treatment has improved so much that even if somebody comes in stage 3 and they are of a certain molecular type, like HER2 positive or triple negative early stage, there
Correct.
is a very good medicine available, and there is more and more of newer medicines coming up. 60% of this stage 3 HER2 positive cancer can be cured. But if you come in stage 1 and stage 2, you have a 90% chance of
Okay.
getting cured with a proper treatment. That's why we tell women that if you have any lump in your breast,
Mm.
any lump,
Okay.
so whether at the age of 30 or 40 or 50, maybe it's not cancer, but let the doctor test it and tell you that this is not cancer. So any lump at any age, please see a doctor.
Correct.
Secondly, any change in the shape, size, or skin of your breast. And
Right.
thirdly, anything in the nipple and areola. If your nipple has gone down, or nipple is destroyed, or there is an ulcer on the nipple that doesn't heal, or the areola, the dark skin around the nipple is thickened, you
Okay.
must see the doctor. And again, if there is any swelling underneath the arm, because that's where the cancer has spread, and also bloody discharge. Any discharge other than milk, you must see the doctor. So
Okay.
these are the 5 cardinal signs of early breast cancer.
All right. So when a patient walks up to you with a lump or with signs suggestive, so how do you investigate them?
First of all, anybody above the age of 40, we
Correct.
would do a mammogram and an ultrasound.
Okay.
to find out, and the mammogram and ultrasound to a large extent can tell you, is it looking malignant or is it not looking malignant.
Okay.
If it is not looking malignant at all, we just leave them. If they are suspicious or they are looking highly malignant, then we go ahead with the biopsy. If somebody is less than 40 years old, the
Okay.
mammograms doesn't help that much, because the mammograms are not very sensitive at a younger age.
Okay.
So we first do an ultrasound, and if the ultrasound says it's a fibroadenoma or a benign guilty or it's a cyst, then we don't do mammograms because mammograms don't help.
Okay.
So remember, a doctor must do a mammogram
Okay.
plus ultrasound if you're more than 40, and ultrasound first if you're less than 40. And if ultrasound says that it looks malignant, then you can go ahead with the mammogram.
All
And
right.
also, there is something called an MRI of the breast, which is even more sensitive than the mammogram. So, there
Correct.
are special indications for an MRI.
So how about a PET scan? Suppose you have a patient in an advanced stage. Would you like to order for a PET scan to evaluate the entire system?
PET CT can tell you if the cancer has spread in any part of the body. So it will pick up. It will pick up in the brain or chest or liver or bones. So if somebody has a stage 2, 2B and 3 cancer, chances are it may have spread. So PET CT is very much in order. But
Okay.
stage 1, you may just do an ultrasound.
Correct. When we talk about tissue diagnosis, so other than just knowing about whether it is what type of a breast cancer is it, there's a lot of role of hormonal markers that we hear. So what is the clinical implication and what are those hormonal markers and how does that have a bearing on the treatment?
First of all, we do need a biopsy, because howsoever sure you might be on your clinical examination,
Correct.
mammogram, and ultrasound, but we cannot take away somebody's breast without seeing the cancerous cells under the microscope. So,
Correct.
biopsy is a must before you start somebody on a treatment. It should be a core biopsy, which is a bigger biopsy than a needle biopsy.
Okay.
And the core biopsy gives you so-called breast tumor tissue, and
Mhm.
that tissue can be examined in addition to saying cancer or no cancer. It further
Mm.
biological markers,
Okay.
and these markers are hormone receptors, HER2 and a lot of treatment. Not a lot, but the treatment of breast cancer should not be started without knowing these markers.
There's another thing that I would love to clarify for the listeners' benefit. A lot of people fear getting a mammogram time and again, because they have this feeling that this itself may induce cancer in the breast. Is this correct? Or is this fear to be dispelled?
It's a fear to be dispelled. The good mammographic machines gives you radiation which is 1/4 of a chest X. If you travel from here to Bombay, you get
Right.
as much radiation as a mammogram. So good quality mammograms do not give you too much radiation for you to get a cancer because of radiation. So one can in their lifetime have 40, 50 mammograms
Okay.
without much problem. So it's not a
Right.
risk.
That's really nice to hear. I think this was something which I wanted the listeners to clarify their doubts pertaining to it. So now let's come
Right.
to the treatment. In the Indian scenario, what is the percentage of patients do you see in the early or in the advanced stage?
We have seen that those who are educated,
Correct.
those who are aware,
Okay.
those who know that their breast will not be taken away if you are an early stage, we can cure you with a breast saving surgery.
Right.
Those who know it's only a question of 3 to 4 months of treatment and you'll be well thereafter, these educated women come to our hospitals in earlier stages.
All
So
right.
we do see about 50 to 60% of the women coming in stage 1 and 2.
That's
But
good.
as we said, if you are not very educated, you are not listening to interviews like you're having, and you don't know the early signs, then you could be delayed and you may not look at your breast. They also
Lovely.
thought that if I come to you, you'll take my breast away. We
Right.
want to tell them your breast will not be taken away.
Mhm.
Fourthly, that it's very expensive treatment.
Okay.
Now, must tell you that earlier stages you may not need chemotherapy. So then your treatment is actually less expensive than you come in stage 3. The treatment is patient friendly these days. It's
Right.
not too difficult a treatment. And we, in addition, continue to support
Mhm.
with yoga, meditation, pranic healing, lots of other things so that you tide over that period of 3 to 4 months for the treatment.
So early and advanced, is it that you're able to conserve the breast in early diseases and not able to do it in the late stages?
Absolutely.
Uh,
So earlier the stage,
right.
the breast conservative therapy can be done. Now studies are showing if done properly by proper people, by proper selection of patients,
Good. Great
the
news.
breast conservative patients live much longer. Now, obviously, we give the choice to the patient because
Okay.
some patients have heard, "मेरा breast निकाल दो, बस काम खत्म हो जाएगा."
We've also experienced in the clinics that the family comes and says that if you leave behind the breast, this itself may become, tissue for cancer later. So why not take the
Right.
entire breast out and not conserve? I think this is what we need to. In our awareness, we should tell them that if we can conserve the breast and show an equal oncological result, might as well do it.
There should be a proper selection for these
Exactly.
patients.
Correct.
I mean, the entire tumor must be out with a good margin.
Right. We always give the choice to the patient and the patient's family, but
Yeah.
the who's the deciding factor at the end of the day? The patient's family or the surgeon has to put his foot forward. No, listen to me.
Yeah, the Paswani, I'm sure it's a problem in your clinic too.
Yeah,
After you explain to them everything
exactly.
and they heard of something else from somewhere else, so at the end they ask you, "Doctor, what will you do?" You know?
Right.
So we actually assess the mentality of the patient, not the
Correct.
relation, the
Correct.
patient. And if patient has said even once that if my breast can be conserved and I live as much as the breast is taken out and I will feel much better psychologically in the social circle, we assess their mentality and then we tell them, okay, I think you'll be okay with the breast conservation.
Right.
Or sometimes they say, I am 70-year-old, I'm 80-year-old, my breast has done the work, just take it off. Then we say, okay, we'll take it off. There is no disadvantage in taking it off.
Right. So even if the entire breast is removed, there's always an option of reconstructing. So even if we have patients in advanced stage and the entire breast is removed, the option of reconstruction is also given to the patient. I think that
Yeah.
awareness also needs to be given. The other is,
Yes.
again, there is a myth with it. So people think that when you reconstruct it, that reconstructed area which looks like a breast again may become a nidus for cancer. So all these fears, I'm sure we need to dispel out
Yeah.
from the minds.
But the Paswani, I must also tell you
Yeah,
that those patients who had a mastectomy done, we tell them after 3 4 years, get
right,
your breast reconstructed.
exactly.
Madam, I'm happy with the prosthesis.
Okay.
I look normal when I have a prosthesis. So I am quite happy with my one breast off. So there are people who get adjusted to life with one breast, but they do wear a prosthesis. So I think the awareness must go that there is a prosthesis available. They are all very good, and to an outside person, you look perfectly normal. If
So
somebody
the
is very
option
proactive and somebody is young and wants a breast reconstruction, yes, it can be done.
given to it. So when cancer happens, it almost changes the life of an individual, the remaining life. There's always anxiety, there's an internal conflict, there's uncertainty, and there's always a fear of unknown. So how do you rehabilitate the psychosocial aspect of these individuals? You talk about chemotherapy, the woman will always say the first fear is losing the hair. They're not impacted with what complications or what other adverse effects they can have with chemotherapy. The hair loss is
Mm,
something which is prominent.
mm,
And
yeah,
then, of course, as we talked about surgery, removing a breast,
yes,
it's considered as a mutilating surgery. So, how do
yeah.
you handle all this?
We mustn't deny the fact that it is stressful to have any cancer in any part of the body. And in the back of the mind, you always feel I can die from it or it can come back. Give them time.
Yeah.
Let them cry for a day or 2 days. I tell them cry. So cry as much as you want, but come back with a better strength, with your inner ability, inner strength to say, I am going to fight it, because you have no other choice. And there are
Correct.
examples to say that if you are very positive and you continue to think my cancer is getting killed with the treatment, when we say you have 6 months of life, people have lived for 6 years. We have these examples. But you have to get up. There is a treatment and you can get well. And we also make them meet patients of similar age group who
Right.
have had the treatment 5 years or 10 years down the line, and
Okay.
now they are having a normal life. So
Right. So if we look at the entire aspect of cancers, one beautiful saying is an ounce of prevention is worth a pound of cure. So what are
right.
the preventive measures that we advise our patients to follow?
The only preventive measures are the 100% preventive measures. If you are BRCA1 and BRCA2, the Angelina Jolie effect, right? She
Right.
had both her ovaries removed and both her breasts removed, because BRCA1, BRCA2 abnormality can cause ovarian cancer and breast cancer. So
Okay.
she had both the ovaries and the breast removed. So now there is no question of her dying of breast or ovarian cancer because of BRCA abnormalities. So if you have a BRCA abnormality, discuss with the doctor. If
Okay.
not the breast removal, at least ovaries can be removed when you finish your childbirth, because that protects ovarian cancer and 50% of the breast cancers. So
Okay.
that's a preventive measure if you're BRCA positive.
Right.
The other preventive methods are not to take hormone replacement therapy.
Mhm.
The third one is to go down or decrease the level of alcohol intake. We continue to say that obesity is a risk factor, we know that. So please do take control of your diet, and then exercise, which means maybe walking every day and keeping your weight under control. And then, as we said, stress level, not during COVID 19, but stress level otherwise.
Yes.
And I'm sure there are lots of videotapes to see how you can do meditation and how you can do yoga to keep your mind, keep your body in control. And
Perfect.
now the other thing that's coming up is a sleep. They think sleep is a very important aspect, and some people are even talking of constipation to keep a good health. So these are the preventive methods. And if possible, again, marry at the right age and have children at the right age.
Okay.
Because having no children or having a first child after the age of 35 is also a small risk factor.
Right. Thank you so much. And before we complete this particular session on breast cancer, what is that little beautiful message that you would love to give it to women who are suffering, who are learning to fight breast cancers, or who are cancer survivors?
Um, the message is that you are a beautiful woman.
Wow.
Love your life,
Great.
love yourself, have great confidence in yourself. You don't have to depend on others to take you to the hospital in case they don't have time. Know your body also says you're not feeling well. Do make a consult with the right doctor. And if you have something, be very positive that maybe God has given you this to make you a better person. He's given for some reason, and that reason you don't know, but maybe it's for a good reason. You're a beautiful woman. This life does not come easily.
Correct.
So just love your life.
Thank you so much, ma'am. Thank you. What a wonderful message. So it's so true that without crossing the worst situations, no one can touch the best corners of life. So one needs to stay positive even in the negative situation to win. So difficulties in life come to us not to destroy us, but they help us to realize our hidden potentials and power. Thank you so much,
Absolutely.
Dr. Sarin, and thank you to all
Absolutely.
the listeners. See you again next week with another talk with another expert. Till then, goodbye.